Today we're going to be covering a number of different objectives. First, we're going to describe the trends in opioid misuse and deaths related to overdose over the last 20 years for both the US and Florida. We'll identify how and why opioids are used and cover their different effects on the individual's brain and body. We'll be describing different risk factors that might contribute to somebody becoming opioid dependent or misusing opiates, as well as different signs and symptoms indicative of opioid misuse. We'll take a look at different screening and assessment tools, discuss how co-occurring disorders impact assessment and treatment, cover a few different evidence-based treatment options for those who are misusing opioids, as well as identify different resources both locally and throughout the state of Florida. So to start with, what are opioids? Opioids are a class of drugs that help reduce pain. Their analgesic properties were discovered several thousand years ago by the ancient Greeks, who found that the opium poppy plant helped reduce pain. Today, the drugs can be made from the plant directly or in a lab using the same chemical structure. Common opioids that are used today include oxycodone, commonly referred to as OxyContin, hydrocodone, commonly referred to as Vicodin, morphine, and methadone. Fentanyl is a powerful synthetic opioid which is made both legally and used in medical procedures like child delivery and illegally. Other opioids include heroin and buprenorphine. So the basics of opioid use and misuse. All opioids are chemically related and interact with the opioid receptors in the brain to help produce pain relief. Opioids are generally safe when taken for a short period of time or in small doses. Historically, opioids have been used to treat moderate or severe pain, often after a major surgery or injury, or for health conditions such as cancer. In more recent years, opioids have been used for chronic non-cancer pain conditions such as back pain. The combination of pain relief plus the euphoric feeling that opioids produce can lead to their misuse, dependence, and problems such as overdose and death. In this webinar, we're defining misuse as taking opioids that are prescribed in ways that they were indicated. Misuse includes things such as taking somebody else's prescription, taking it for that euphoric effect that they produce, or at a higher dose than was initially indicated. Why opioids are so addictive. We know that opioids affect different parts of the brain, including the prefrontal cortex, the nucleus accumbens, or the quote-unquote pleasure center of the brain, the ventral tegmental area, and the locus coeruleus. Opioids stimulate specialized proteins called mu-opioid receptors in the brain. In the ventral tegmental area, cells produce and release dopamine, resulting in feelings of pleasure. Feedback from the prefrontal cortex to the ventral tegmental area helps us overcome drives to obtain pleasure through actions that may be unsafe or unwise. But this feedback mechanism appears to be compromised in individuals addicted to drugs such as opiates. The locus coeruleus plays an important role in drug dependence and withdrawal symptoms as opioids impact the locus coeruleus's ability to produce and release noradrenaline. Opioids have a number of different effects on the body. This includes slowed breathing, sleepiness or dizziness, constipation, confusion, and other symptoms such as dry mouth, nausea, possibly vomiting, low testosterone or sex drive, possibly itching or sweating, depression, and potentially a physical dependence syndrome that includes symptoms of withdrawal. People taking opioids may also be at higher risk of being sensitized to pain. The risks for these effects are greater for women who are pregnant, those who are of an older age, those who have comorbid mental health conditions such as anxiety or depression, and those who have a history or family history of drug misuse, substance abuse, or overdose. The statistics around opioid use are staggering. The CDC reports that 48.5 million Americans have used illicit drugs or misused prescription drugs. Nationally, it's been reported that 130 Americans die every day from an opioid overdose for the year 2016. This includes both opioids that have been prescribed by a medical provider or illicit opioids like heroin or fentanyl. Here, we can see different trends in overdose deaths related to opioids over the last 17 years or so. On the left-hand side of the graph, we can see that for 1999, opioid deaths per 100,000 people were about 3. This number steadily increased throughout the early 2000s and peaked at around 16 people per 100,000 in 2017. The purple line refers to commonly prescribed opioids like hydrocodone or codeine. You can see that the deaths related to those prescribed opiates is at about 1 per 100,000 for the year 1999. Due to overprescribing of these opiates, we see that this line steadily increases through the early 2000s to 2017, rising from about 1 death per 100,000 to about 5 or 6 deaths per 100,000 in 2017. While increased public attention has been drawn to the problem of opioids, overprescribing, and overdose, different states have invoked different policies to curb overprescribing. As a result, we do see a slight dip around 2011 for overdose deaths related to commonly prescribed opiates, but we start to see an increase in deaths related to other opiates like heroin and synthetic opiates such as fentanyl and tramadol. For heroin, again, we see just about under 1 overdose death per 100,000 people in 1999. And this number skyrockets after 2010, going from about 0.5 deaths per 100,000 to 5 per 100,000 in and around 2016-2017. For synthetic opioids, such as fentanyl and tramadol, we similarly see a low rate per 100,000 of overdose deaths throughout the early 2000s, steadily increasing in 2013 to a peak of about 9 deaths per 100,000. And this chart can be spliced into these three distinct waves. We see wave 1, indicating the rise in prescription opioid overdose deaths and related in part to overprescribing of those common opiates. We see wave 2 around 2010, showing the rise of heroin overdose deaths. And then finally, wave 3 in about the year 2013, showing the rise in synthetic opioid overdose deaths. So why are synthetic opioids so dangerous? For 2017, the largest increase in opioid deaths involved synthetic opioids such as other than methadone, which includes illicitly manufactured drugs such as fentanyl. Synthetic opioids were involved in 59.8% of all opioid-involved overdose deaths, with increases across all demographic categories. The highest death rate was in males aged 25 to 44, which is at about 27 deaths per 100,000 people. And the largest relative increases occurred among Blacks, American Indians, and Alaska Natives. Part of the reason for these deaths is because opioid receptors are related to areas in the brain that help control our breathing. Synthetic opioids, like fentanyl, are highly potent, which greatly increases the risk of overdose, especially if a person who uses drugs is unaware that a powder or pill contains fentanyl. High doses can cause breathing to stop completely, which can lead to death. Fentanyl that is sold on the street can be mixed or cut with heroin or other drugs such as cocaine, which markedly amplifies its potency and potential dangers. In Florida, we see that for 2016, there were 2,798 opioid-related overdose deaths, which is a rate of about 14.4 per 100,000 people. This is comparable to the national rate of 13.3 deaths per 100,000 people. We see this sudden surge, which in 2013 was at a rate of about 200 deaths, to the number of deaths for 2016, which is 1,566. Increases in this time period for opioid-related deaths are partly attributable to Florida's history of weak regulations, leading to pill mills and high prescription rates for opiates, though state laws have been passed to decrease these practices. Here, we can visualize what's happening with regard to the rate of opioid-related overdose deaths in Florida compared to the national averages. On the left-hand side, we see that Florida and the national average for the U.S. is at or around 2.6 deaths per 100,000 people for the year 1999. Again, over the early 2000s, we see this number rise and rise, initially peaking around 7.1 in 2004, dipping and then continuing to rise, peaking again at 2010 at 9.1, slightly decreasing due to the introduction of different legislative measures and cracking down on prescribing practices, and then with the uptake of other drugs such as the synthetic opioids or heroin, again we see with the greater use of high-potency opioids, the number of overdose-related deaths increasing, peaking at 14.4 for the year 2016. On the right-hand side, you can see these opioid-related overdoses broken down by type of opiate. So again, on the left-hand side, you can see high rates of prescription opioids being attributed to the cause of death. Then, as the 2000s wear on, you can see that At about 2011, the number of opioid-related deaths for heroin starts to markedly increase. And for the year 2013, you can see that synthetic opioids like fentanyl and tramadol are responsible for a greater number of overdose deaths. One example of Florida's increased legislative involvement in the opioid crisis is the Prescription Drug Monitoring Program. eForce, the Electronic Florida Online Reporting of Controlled Substances Evaluation Program, was created by the 2009 Florida legislature to encourage safer prescribing of controlled substances and to reduce drug abuse and diversion within the state. The database became operational in 2011. eForce and the Prescription Drug Monitoring Program requires dispensers of controlled substances to report all transactions within 7 days. This permits licensed healthcare professionals, including physicians, dentists, osteopaths, podiatrists, pharmacists, physician's assistants, ARNPs, and optometrists to register and use the database in treatment planning prior to prescribing a controlled substance. So now we're going to be talking a little bit about identifying opioid misusers. We'll be talking about different risk factors that contribute to opioid misuse, as well as different signs and symptoms of opioid misuse. So what makes some people more vulnerable to misuse than others? We can identify different risk factors that contribute to this, such as obtaining overlapping prescriptions from multiple providers and pharmacies, commonly referred to as doctor shopping, taking high daily doses of prescription opiates, having mental illness or a history of alcohol or other substance abuse problem, or living in rural areas, or having low income. There are a number of different signs and symptoms that you can be on the lookout to help identify opioid misuse. These include things like irritability, slowed or depressed breathing, sedation or drowsiness, confusion, constricted pupils, or more social indicators like poor decision making, social withdrawal from activities and responsibilities, increased tolerance to the opioid, such as needing an increased dose for pain relief, or worsening or increased sensitivity to pain, also known as hyperalgesia. Other signs and symptoms can include things like mood swings, depression or anxiety, constipation, noticeable elation or euphoria, or intermittent nodding off. Some social and behavioral indicators of opioid misuse include behaving differently, withdrawing from social or recreational activities, noticeable changes in mood or behavior, such as avoiding friends and family, financial problems, making bad or reckless decisions, or missing school or work due to use. A number of red flags are also apparent in individuals who are possibly misusing opiates, such as stealing drugs from other people, obtaining prescriptions from non-medical providers or other medical sources, using alcohol or illicit drugs in addition to their opioid, increasing the dose of their opioid or being non-compliant with the instructions of their physician, requesting specific types of opioids, specific dosages, or routes of administration, or using the opioid in a way that was not other indicated, such as treating symptoms or conditions other than the original problem. Now we're going to be talking about different screening and assessment measures for individuals who are at risk or who are misusing opiates. We can break these down into 3 different categories that are designed to detect risk for patients at different points related to their use of opiates. We can look at assessment measures that are looking to identify those who are at risk of opioid misuse or dependence prior to the initiation of treatment, signs for misuse in patients who are currently using opioids, as well as assessment measures for mental health and non-opioid general substance abuse. So here we have a number of recommended instruments for assessing the risk of opioid misuse before initiating long-term opioid therapy. The Opioid Risk Tool, or ORT, the Screener and Opioid Assessment for Patients with Pain, revised edition, the Screening Instrument for Substance Abuse Potential, and the Diagnosis, Intractability, Risk, and Efficacy Score. Today we're going to be talking about one of these tools, the Opioid Risk Tool. The Risk Tool is an easily administrative screening tool. It takes about a minute or so to complete and is completed by the patient or client. It's designed for use with adult patients in primary care settings and is used to assess risk for opioid abuse among individuals prescribed opiates for treatment of chronic pain. Patients that are categorized on the Opioid Risk Tool as being high risk are at increased likelihood of future abusive drug-related behavior. It can be administered in person and takes less than a minute to complete, and has been validated on both male and female patients. So on the right-hand side, you can see an example of the Opioid Risk Tool. It's 5 questions long, and the client or patient, depending on their gender, goes through and fills out their information about their family history of substance abuse, if their family has a history of alcohol abuse, abuse of illegal drugs, abuse of prescription drugs, whether they themselves have a personal history of substance abuse, again related to any of those 3 categories, information about their age group, whether they have a history of pre-adolescent sexual abuse, any sort of psychological diagnosis such as OCD, ADD, bipolar disorder, schizophrenia, major depressive disorder, and so on. The provider tallies up the points from those 5 categories, and you can arrive at a score that either puts the client or patient at low risk for opioid misuse, moderate risk for opioid misuse, or high risk for opioid misuse. There are a number of different strategies that providers and patients and family members can engage in to prevent opioid misuse from occurring. Providers, first and foremost, can use non-opioid therapies whenever possible. Before initiating opioid treatment, the provider can discuss benefits and risk with patients and evaluate their risk through things like the ORT. They can set criteria for stopping treatment or continuing opioids, continuously assess pain and overall functioning, and then reassess each visit, whether that be weekly or monthly. And then further, the provider can also prescribe short-acting opioids using the lowest effective dose. Patients and family members can never take opioids in greater amounts or more often than is prescribed without talking to their provider. They can also talk to their provider about other ways to help manage their pain as well as knowing the side effects of opioids and discussing their concerns. They can avoid drinking alcohol while taking opioids and avoid prescriptions, if possible, for things like benzodiazepines, muscle relaxants, hypnotics, or other prescription opioids. Patients and family members can help prevent misuse and abuse by never selling or sharing prescription opioids or using another person's opiates. They can also help by storing prescription opioids in a secure place and keeping out of access of others. When they no longer need their prescription, they can safely dispose of unused prescription opioids. Secondly, there are assessment measures for monitoring for signs of opioid misuse in patients who are receiving long-term opioid therapy. So this is for patients who are already taking a prescription opiate for greater than 90 days. There are a number of recommended assessment measures, such as the Prescription Drug Use Questionnaire, the Opioid Misuse Measure, the Patient Medication Questionnaire, the Assessment and Documentation Tool, and the Addiction Behavior Checklist. And then finally, there is mental health screening assessments that can be used to see if there is an underlying comorbid condition that might make it more likely for somebody to misuse or become dependent on opioids. Examples include the Patient Health Questionnaire, the Generalized Anxiety Disorder Questionnaire, or things like the Hamilton Depression Rating Scale. Talking a little bit more about co-occurring disorders that impact the assessment and treatment of opioid use disorders. There's common comorbidity between substance abuse disorders and mental illness. Why is this? Common risk factors contribute to both substance use disorders and mental health problems, including things like genetic vulnerabilities, epigenetic influences, brain region involvement in both disorders, environmental factors, stress, trauma, and adverse childhood experiences. Mental health problems can contribute to drug use and addiction through what is commonly referred to as self-medication of the symptoms. Substance use and dependence can also contribute to the development of mental health problems. Chronic pain is a physical problem that has a complex relationship with opioid misuse and addiction. An estimated 10% of chronic pain patients misuse prescription opioids. Chronic pain and associated emotional distress are thought to dysregulate the brain's stress and reward circuitry, increasing the risk of opioid use disorder. One of the largest drivers of physical health comorbidities is cigarette smoking and tobacco use. It is linked to many major health conditions and remains the leading preventable cause of premature disease and death in the U.S. The majority of lung cancer and approximately 1/3 of all cancer-related deaths are attributable to smoking. An estimated 77 to 93% of people in treatment for substance use disorders, such as opioids, smoke or use other tobacco products. Mental illness may lead to substance use disorders and vice versa. Thus, substance use disorders may play a role in linking mental illness and physical health. Substance use disorders can have an indirect negative impact through their relation to the transmission of other infectious diseases. As a result of these different comorbidities, it is important that we take a more holistic look at the patient and have an integrated care plan. This includes things like making sure that the patient or client has access to any necessary substance abuse-related medications, such as buprenorphine or naloxone or methadone, behavioral therapies like CBT or motivational interviewing, other supportive services, collaboration by providers in the patient's team. So now we'll be talking a little bit about treating opioid misuse. We'll be talking about different interventions to reverse opioid overdose. Popular medication-assisted treatment options like methadone or buprenorphine, and combined treatment options. First and foremost, we're talking about opioid overdose. There are a few different ways that you can try to recognize a potential overdose. The person may be unresponsive to a sternal rub of their chest. When their name is said loudly, they are unresponsive. They have slow or shallow breathing, or may not be breathing at all. Choking sounds or snore-like gurgling noises may also be present. Their face may be discolored, showing a blue or graying of the skin and lips. If you notice any of these signs of an overdose, there are 5 steps that you can take to help save a life. First, try to wake the person up. Again, rubbing their sternum or shouting their name to try to get them to regain consciousness. You should call 911 and indicate to the responders what your location is and what is happening. If you have naloxone, a drug that is used to help reverse the effects of overdose, you can administrate it to the person. Continuously check for breathing and stay with the person until help arrives. If you walk away from the person after calling 911, it is possible that they may regain consciousness and in a state of confusion or disorientation wander off, potentially leading to them to be able to be injured or pass out again. Naloxone is a common drug used to help reverse the effects of opioid overdose. It can be given intranasally through the nose via a spray, intramuscularly through an injection, or subcutaneously under the skin, in addition to intravenously. Narcan, which is the intranasal spray form of naloxone, and Evzio autoinjector are also options. Naloxone acts as a reversal agent through its antagonist properties and helps restore normal respiration to the person. Naloxone is available in many pharmacies across the state and nationally without a prescription. In some cases, you may not have to pay the pharmacist for naloxone. iSaveFlorida.com offers further useful information about finding treatment centers for somebody that has a substance use disorder, helps people locate available naloxone in their communities, offers tips about recognizing an overdose, and other information about helping save lives. When treating somebody with opioid use disorder, it's important, again, to take a holistic whole patient approach to treatment. This means providing medications that are related to mental health or other health conditions, behavioral therapies like cognitive behavioral therapy or motivational interviewing, and medication-assisted treatment options that include things like methadone, buprenorphine, and naltrexone. Nearly 80% of persons with opioid use disorder do not receive treatment. medication-assisted treatment is one effective response to opioid use disorder. It uses medications and behavioral therapies to provide a whole patient approach for the treatment of opioid misuse. Individuals receiving medication-assisted treatment often demonstrate dramatic improvement in addiction-related behaviors and overall psychosocial functioning. Common medication-assisted treatments include methadone, a long-acting synthetic opioid antagonist, which binds to the opioid receptors in the brain that provide pain relief and helps decrease drug cravings. It can be taken orally on a daily basis and has been used during pregnancy to promote healthy outcomes in women who have opioid use disorders. Women who are pregnant should consult their medical provider, as methadone has been associated with neonatal abstinence syndrome. Mothers maintaining on methadone can breastfeed if not HIV positive, abusing other drugs, or have other infectious diseases. Buprenorphine is a newer medication used to treat opioid misuse and dependence. It's a synthetic opioid that acts as a partial agonist at opioid receptors. Buprenorphine does not produce the euphoria or sedation caused by prescription opiates and other illicit drugs, but is able to help reduce and possibly eliminate withdrawal symptoms. It can be taken under the tongue, often dissolving. Naltrexone is also a newer option, which is a synthetic opioid antagonist that helps block opioids from binding to the receptors and prevents that euphoric feeling and other opioid effects. It helps prevent people who have been addicted to opioids from taking them again, as once they take an opioid again, a lot of the properties of the drug will be blocked by the naltrexone. It's usually prescribed in outpatient medical settings, but treatment should begin after medical detoxification to prevent withdrawal symptoms, which naltrexone can sometimes induce. Opioid withdrawal is one of the most powerful factors driving dependence and addictive behaviors. Withdrawal happens when there's a sudden decrease in the dosage or cessation of opioid use. This can occur even when opioids are prescribed and taken appropriately. Signs and symptoms of withdrawal may start anywhere between 6 to 16 hours after stopping opioids and can last 7 to 10 days, but sometimes can last weeks or months. These can include symptoms such as overwhelming craving for opiates, anxiety, irritability, and depression, runny nose or watery eyes, sweating or shaking, yawning, muscle aches or cramps, chills or goosebumps, and trouble sleeping or being tired throughout the day, as well as nausea, vomiting, and diarrhea. Withdrawal is one of the most powerful factors driving opioid dependence, and it is necessary that a patient going through withdrawal receives the care that they need. Care options include inpatient and outpatient treatment. Long-term inpatient treatment can be provided in residential or therapeutic communities, which offer 24 hours a day service. This can last 6 to 12 months or more and is a highly structured environment offering comprehensive services such as individual counseling, group therapy, medical care, psychiatric care, and more. Short-term treatment options are usually provided in substance abuse treatment centers and hospital settings and can last anywhere between several days to several weeks. There's also brief treatment options at the outpatient level. Outpatient treatment programs can vary wildly in type and intensity of services. It costs less than residential or inpatient treatment, but may be more suitable for higher functioning patients who have jobs or extensive social support networks. Outpatient treatment programs can offer intensive day treatment that's comparable to long-term residential services and is comparable in effectiveness if suitable to the patient's characteristics and needs. Group counseling is a major part of any outpatient program. Some programs have been designed to address other co-occurring physical and mental health problems, such as chronic pain or depression, anxiety, OCD. In treatment, there's a number of behavioral therapies for opioid misuse. These can occur at the individual level, the family level, or the group level. No single treatment is appropriate for everyone, and matching the correct treatment setting to the patient's needs, matching the appropriate intervention to the patient's symptoms and complaints, enhances their ability to succeed. Remaining in treatment for an adequate period of time is critical. If the client or patient leaves treatment too early, they might be at a higher risk for relapsing. Again, as we've said throughout, effective treatment attends to the multiple needs of the individual and uses a holistic approach to their care. Some takeaways for health professions students or other interested participants in this webinar to consider. You should consider your role in identifying, assessing, and treating persons with opioid misuse. We hope that you've been able to learn some different signs and symptoms for people who are currently experiencing opioid misuse, as well as risk factors. We hope that you're able to think about how you can help save lives in preventing deaths from opioid-related overdoses. As well, we have a number of resources that we'd like to share with you, your patients, friends, and family members. We offer a number of resources for you to learn more about opioid use disorder, treatment, and assessment. First is SAMHSA's Tip 63 Medications for Opioid Use Disorder Treatment. Second is SAMHSA's Opioid Overdose Prevention Toolkit, which is also available in Spanish. This toolkit offers information and facts from the literature and links to resources to prevent opioid-related overdoses and deaths. Because interdisciplinary collaboration is critical to success, SAMHSA offers the toolkit as an educational resource for community members, first responders, prescribers, patients, and families. Other resources include a clinical guide for the treatment of pregnant women who have opioid use disorder, as well as their infants. SAMHSA's prescription pain medication Know the Options, Get the Facts information sheets are also useful to increase awareness of the risks associated with prescription opioid use and misuse, and are useful to help educate patients who are prescribed opioids for pain about the different risks, as well as to provide resources on methods for alternative pain management. In Florida, DCF's overdose prevention program includes public health education. The material below is incorporated into the Florida Department of Children and Families Overdose Prevention Program, educating the public about helping people at risk of experiencing an overdose. DCF has a number of substance abuse and mental health managing entities, including Big Bend Community-Based Care, the Broward Behavioral Health Coalition, the Central Florida Behavioral Health Network, Central Florida Cares Health System, the Lutheran Services Florida, South Florida Behavioral Health Network, Southeast Florida Behavioral Health Network, The National Council for Behavioral Health, the National Institute on Drug Abuse, and the National Institute on Drug Abuse Principles of Drug Addiction Treatment Guide are all useful resources for learning about treatment and assessment options.